Hello and welcome to day 3 of our health awareness journey. I hope you have been enjoying the series so far. My name is Aladiti Yukorede and I told you before I'm a sonographer. I deal with ultrasound. So yesterday we talked about how powerful a simple blood test can be. Today we are going to be a bit deeper into some common misunderstanding people have about medical tests. And most importantly, we also discuss a question many people don't ask until it's too late. When should I even go for a checkup? It's a very important question you should always try to ask yourself because some people believe if there is nothing wrong with you, you don't need any test. Anyway, here are some misconceptions about medical tests. I have some 5 points which are commonly noted from our people. So, one, I feel fine. I don't need a test. I feel fine. I don't need a test. Meanwhile, in reality, many serious conditions like high blood pressure, diabetes, and some cancers show no symptoms at first. I call them silent killers. Some illness hide quietly in your body. By the time symptoms show, damage have already been done. A checkup helps you to catch those silent problems very early to avoid their problem. So if you think until you are having a symptom, that's when you should go for check, you are wrong. You should go for check because it doesn't only diagnose, it prevents. That's number one. Then number two, blood tests are only for sick people. Like I said, it's not until you are sick. It's not just test is not just to show you a diagnosis. It can show you a way of preventing, a certain disease from getting complicated. You understand what I'm saying? So that's number two. Then number three, some people will say your doctor just wants you to do the test because they can have some money. The reality is no doctor wants you to suffer from something that could be prevented so early. Doctor recommend tests because they want to catch up your health issue earlier. Prevention is not just cheaper, it's a life saving. So there is no doctor that will just want to eat your money for recommending some tests for you. I think it's important to check your history and to know some things about you and also be familiar with the condition of your health so that they can always administer the right medication earlier before anything gets complicated. Then four, at least, all tests are painful and scary. To some people, they believe all tests are scary, painful. But to say the fact, the medical tests are quick, gentle, and over a minute, most of them. A blood test might even feel like a tiny pinch. A scan might just need you to lie down, put a kind of gel in your body, then rub with a certain transducer which we call probe, then that will transfer your image to the screen, then you can be able to see your internal organ. That's not by any means having any medical hazard or health hazard at all. You understand what I'm saying? So it is good that you understand that not all medical tests come with pain. In fact, currently that we are on digital equipment, it is not always necessary to experience any pain during medical check. Then some people believe that one test is enough for a lifetime, that if I've done the test this year, I don't need to do the test again next year. That is very, very wrong. You have to be checking up on yourself every year, at least minimum of every year, to ascertain and notice some change that has occurred within the organ that are not good for the body. It makes you become aware about your health. It's just like your phone. People that use iPhone, to get to an extent, they will tell you to update. You understand? So you have to be checking your system. When you are using a car, you want to go and service it. Your body is an engine which needs care the way you are caring for your car. So you should remember to always go for tests before any issue arises. So when should I go for a medical checkup? It's what I've explained, but I will still put more elaborate statements in that regard. Now, let's talk about a crucial but often skipped topic. When should I actually go for a medical check? The answer is simple. Don't wait for pain or panic. There are signs and even silent reason to check in with your doctor. It is not until anything is wrong, at least once in a year, even if you feel 100% okay, go for an annual check. Just like a car, like I said, and like a car needs a routine service, your body also does. So you have to understand that when you feel unusual tiredness, dizziness, or weight change, or you notice, or you notice some kind of mass on your body and it's not going very fast, those small symptoms might look harmless, but they could signal big issue like anemia, thyroid problem, or infections. If you notice bleeding, lumps, or pain that doesn't go away, don't ignore anything that feels strange in your body. Early detection saves life. You notice some bleeding that, or probably your period, it's lasted for 5 days, but this is now going for the period of 8 days. It's going for the period of 9 days. There is a problem with that, and you really need to check. You feel some lumps in your breast, in any part of your body, and you notice they are not going earlier, definitely it calls for attention. You need to check for it and be certain that's not causing any problem. Just a simple test will give you idea about all those things. If you now need any further investigation to correlate with the former investigation you have done, then the doctor will put you through, or the medical lab sciences, or the person that is attending to you will always advise you on the necessary tests to take. So if you notice bleeding, lumps, or pain that doesn't go away, you should always try and check very fast, because all those things might be giving you a very serious and important point to note. So before marriage or pregnancy, before marriage, it is good. Yesterday we discussed genotype, and we talked about how important it is in regards of marriage. When you are about to get married, it's good you check your genotype. It's good you check for infection. It's good you check your fertility, your hormones, and be sure your fertility organs are in good condition. You have to check your hormones, check your prolactin, check your progesterone, check your estrogen, check your luteinizing hormone, check your follicular hormone. In the regards, you'll be certain that there is no problem or disorderness or imbalance in your hormone, or something like a fibroid mass. You'll have detected it earlier. So if there is a way to sort the problem, you'll have sought before you get married. So it's always very good to check yourself and your spouse before you get married. Very, very important. And I told you, if you do your genotype, you know that you are AS, you shouldn't go for AS. If you do your genotype, you are SS, you can only go for AA to avoid sickle cell or birth complication. So, other one is after age 40. Even sooner, some will clock that age. So, your risk for conditions like diabetes, prostate issue, and high blood pressure increase. Get checked earlier and regular, most especially when you are at the age of 40, because you are tend to have diabetes, prostate enlargement, prostatic mass, high blood pressure, and if you have checked and you know all those things, you'll be able to give a good solution before they cause any medical problem. If there is family history like hereditary, you also need to check to avoid any complication from that side.